Hello, everyone, and welcome. I'm Christina Hawes, the Community Engagement Coordinator for the Community Outreach and Engagement Office of Wilmot Cancer Institute. I'd like to welcome you to today's webinar, Exercise as Supportive Care Treatment for Cancer-Related Toxicities. This webinar is a part of our Community Conversations on Cancer series, an educational series designed to inform, educate, and disseminate best practices in cancer research, clinical care, and community engagement. It is sponsored by the Office of Community Outreach and Engagement, CERTEC, and the Community Cancer Action Council, or CCAC. This live event has been approved for one AMA PRA Category 1 credit and is pending for one CNE credit for nurses and one contact hour for social workers. If you would like to receive credit for attending, please make sure to fill out the post survey. Our presentation today will be followed by a facilitated Q&A session. Throughout the presentation, please feel free to enter any questions in the Q&A box located at the bottom of your screen. Now, let me introduce our wonderful speakers. Dr. Poju Lin is a research assistant professor in the Department of Surgery, assistant director of the Peak Human Performance Science and Clinical Research Lab, and service leader of the Wilmot Cancer Institute Human Biophysiology Shared Resource at the University of Rochester Medical Center. Dr. Lin received her PhD in kinesiology and MPH in human nutrition at the University of Michigan and completed her postdoctoral training in supportive care in cancer at the University of Rochester Medical Center. Dr. Lin is an internationally recognized expert in exercise oncology, behavioral medicine, integrative medicine, supportive cancer care, and survivorship, with more than 15 years of clinical research experience. She's also an American College of Sports Medicine certified clinical exercise physiologist, a registered dietitian, and a certified yoga instructor. Adam Sispowski is an American College of Sports Medicine certified clinical exercise physiologist and cancer exercise trainer. He manages the Peak Human Performance Science and Clinical Research Lab with more than 6 years experience in clinical research, delivering exercise and behavioral interventions, and performing physical function assessments. He has received his master's degree in exercise science from the University of Buffalo. And finally, we have Autumn McLean. Autumn leads wellness activities across multiple branches of the YMCA. She graduated from Wells College as a 3-sport athlete and has a personal love for fitness and improving overall well-being. With 5 years experience in the YMCA community and over 10 years experience in aquatics, overseeing a wide variety of programs for all ages and demographics, Autumn is dedicated to creating inclusive, impactful programs that promote healthy living and strengthen community wellness as a whole. So welcome to our presenters. And without further ado, I will now hand it over to Dr. Lin.
Hello, everyone. Can everybody hear me fine and also see the slides?
You're perfect.
Okay, thank you. Thank you, Christina, for the very kind introduction. And hello, everybody. I am delighted to have this opportunity to share some of the research we have been conducting at WOMA and also the URCC Anchor Research Base. And we at Peak Human Performance Clinical Research Lab, like we are helping investigators to deliver and also kind of like help the design the behavior intervention and have those intervention to help patients receiving treatment or post-treatment to manage their treatment or disease-related side effect and toxicity. So today I'm particularly gonna emphasize the two behavior intervention we developed by our director and colleague. One is exercise program and the other one is a yoga program. And we have been using this two behavior intervention for multiple local and regional and also nationwide clinical trials. And so I'm very excited to share, kind of like summarize the finding we have received, we have collected and also I'll share with you guys. And afterwards, Adam is an exercise oncology professional. Like he will share the survivorship program, like also run by us, and also share of some of the experience that he worked with patients and survivors. So before we go into the research results, and this is just kind of like a brief introduction to share the some facts, like cancer facts and statistics. So cancer is the second most common cause of death in the United States, and the every person, like the risk of to develop the cancer throughout their lifetime is 1 in 3 people. This sounds very scary, right? But thank God for the screening tool and assessment, and as well as the advance in treatments. Like the survival rate has been notably improved, like over the 3 decades. So like on the table here on the right, you can see like for each individual different cancer type and their 5-year relative survival rate in 70s until recently, like during 2014 and 2020, if we consider all cancer type, the survival rate is it's improved from 49% to 69%. So with the screening and also like early detection and also the advancing treatments, like people are surviving from cancer. With that, so a lot of people, because they survive, and most of them they will need to manage the treatment or disease-related toxicity. So that's bring up our focus for the using some of the behavior intervention to help patients to manage the side effects. So this is the exercise program developed by us. So we call exercise for cancer patients. This is a standardized and individually tailored progressive home-based exercise prescription, and including daily walking and the resistance band exercise. So on the picture here, you can see like all the study participants, like participant in our exercise intervention, they will receive this XCAP kit, which will include the resistance band, activity tracker, a manual. So they will meet with our exercise professional to get their individualized exercise prescription, and also have the prescription to progress throughout the entire intervention period. So the walking we will usually provide some form of activity tracker for people to monitor their daily step to begin with. And based on those information, our exercise professional can provide appropriate progression like weekly to help patients to improve their number of daily steps. This program also includes 16 resistance band exercises, and by meeting with our exercise professional, we will consider your baseline range of motion, physical ability, and also consider all some of the medical condition you might have, or physical condition you might have, to provide appropriate prescription for each individual exercise, and also the progression. So these are some of the results figure we got from a local study which conducted at Walmart and affiliates. This study, we recruit 90 women with breast cancer, and they were either recently finished their treatments, or they were actively receiving radiation therapy. So some of the kind of like the key finding we found after they participate in our exercise intervention, we found that those people in the exercise arm, they are improve their fatigue level, and on the figure on your right on the left-hand side, we are using one of the valid questionnaire to monitor their cancer-related fatigue, and that's a multi-dimensional instrument, and that will be able to measure like a different dimension of a fatigue level, and the exercise help mainly for the general and the physical fatigue, and also improve their vigor level. Um, we also measure their upper body and the lower body muscular strength. And we, after participating in the exercise intervention, the people are significantly improve their, particularly the lower body muscular strength. We also find the benefits for those people in the exercise arm. They improve their sleep and also have less memory difficulty. So as I mentioned, for the study I just shared with you, that was conducted locally and with a smaller sample size. And we are very fortunate to have this platform at Rochester in Rochester, New York. That we have this the National Cancer Institute sponsored community oncology program. And throughout the entire nation, we have uh, 31 affiliate community oncology practice. When I say 31, that's more like the affiliates, but each affiliate also have the multiple satellite sites and surrounding area there, like hospital healthcare system, and also community oncology. So with this platform, we will be able to introduce our study to all our affiliate sites and have them to help us recruit patients across the nation and do a study. So that's like bring the study clinical trial like become like a larger scale and not limited to a small region and across the entire nation. So we have this platform help us to conduct the study. So the following study, like I'm gonna introduce and share the finding is the study conducted using this platform. So you can clearly see the sample size is gonna be a much larger than the prior local study. So this study is also used and because they are receiving chemotherapy and a very common toxicity they have been experienced are chemotherapy-induced peripheral neuropathy. By participating in the exercise program, on the figure on the left, like you could see like from before they participate in the intervention versus post-intervention, although everybody their CIPN symptom become worse, you can see the exercise is sort of like it provides some sort of protective effect. So by doing exercise can help the CIPN symptoms like less worsening. We also found those people who are in the exercise arm, like they show they reduce their anxiety level. So those are sort of like a key symptoms that we have like share with you. We also have conduct other analysis and show the same exercise intervention can also help with the cognitive impairments and anxiety, mood, and muscular strength. And I would like to particularly highlight cancer-related fatigue. Because like first of all, that is a very like among one of the most common side effects experienced by patients and survivors. And a lot of time, even patient post-treatment, they will continue experience fatigue. And we recently the exercise is published in 2024. Exercise is one of the very effective supportive cancer care recommended in American Society of Clinical Oncology clinical guideline to prevent and to manage fatigue for those for patients like during treatment and also post-treatment. So that's also like our studies show that effect, and also along with many other studies, so that make the exercise be considered as a clinical guideline to manage fatigue. And then the second part of my presentation, I would like to switch the gear to a different behavior intervention. It's yoga. So we also developed this yoga for cancer survivor, abbreviated as yogas. This is based on gentle hatha and the restorative yoga, and they have like three key components, including like physical alignment, postures, breathing exercise, and the mindfulness. It's a 4-week program. Participants will meet with yoga instructor twice a week for 75 minutes. They will also have a kit for them to encourage their home practice. So we have been using this behavior intervention to conduct a multiple clinical trial, including a 2 phase 3 nationwide clinical trial, one recruiting 410 cancer survivors, and the follow-up study 2, we recruit 740 cancer survivors. And the primary outcome for the yoga study is insomnia and the sleep disturbance. And we see even just after 4 weeks of the intervention, the survivors like show a very notable and also significant improvements in their sleep condition. And we also see a very strong yoga effect helping patients manage their cancer-related fatigue. And that's also seen on both studies. Cognitive impairments, like we are using some of the questionnaire, like including asking their memory difficulty, asking one of the instruments is more like symptom inventory. So they are recording like how their cognition function was graded, and we saw that yoga group showed like a significant improvements after a 4-week intervention. So similar as the exercise intervention, like we also test other common side effect and toxicity, and the yoga also demonstrate can effectively improve anxiety, moods, and alleviate the muscle ache and the pain, and also improve their ability to walk, and also improve like general activity and the overall quality of life. So before I go into like a future direction, I do want to mention this 2 behavior intervention we introduced here. We also have a strong evidence base, and which we think those are effectively help patients. However, like we all know, like we have most of patients survivor know, oh, there's a recommended exercise dose and thing, but we still have a very low prevalence of the people or patients that actually meet the exercise recommendation. So I always want to say like the most effective behavior intervention is the behavior intervention patient and survivors are safe to do and also willing to do. So then, all the behavior intervention, we always want to make sure that it is feasible, it is doable, and the patient are willing to do it, and it's also to make sure the sustainability, right? So for all the study I mentioned earlier, not only we show a very strong intervention effect, that we also have a very high adherence and compliance rate. So like more than 80% of those participants, like they are they are able to do it, and also a lot of very positive feedback we receive from patient survivors. Like they like to do it. They will recommend those behavior intervention to participants. So so of course we are gonna in the future that we're gonna continue to do a study and accumulate more like large scale nationwide clinical trial, and hopefully not only the fatigue guideline, we can also have the exercise or yoga be considered as a supportive cancer care for other toxicity patient survivor my experience. And we also need to sort of understand and also further like how we can implement. Like now we know like those are very effective helping patient, but how we could implement that and disseminate that to to patient and survivors. And the other thing I do want to mention for our intervention particularly is like I feel like the individualized and the exercise prescription is one of the key components that make our intervention works, because the patient um, a lot of time like they are not necessarily know how to start with, and also they also we also do not want patient or survivors got injured. So by talking to exercise professional and then find out their physical condition, their physical ability, and to provide appropriate prescription is, I think, is very important, and also the key why the intervention will be effective to help patients. Um, and everybody know like what happened 5 years ago, and also what we have been adapt from 5 years to now. So like we right now we have a lot of intervention and assessment, and also including a lot of like a screening and consenting procedures, which we will incorporate the technology. So help us to reach out to people who might have transportation difficulty, or have other barrier to visit clinic, or even visit some of the supported cancer care center. So we have start to incorporate a lot of technology, including the electronic data collection, um, try to reach out people without even have any in-person contact, and can still have the participant to offer the opportunity for participant to participate to a clinical trial. And we using that to electronic data collection, also for the intervention delivery. So for the prior study I mentioned to you, most of those interventions were conducted years ago, and also before COVID, and also most of those interventions were conducted in person. Right now, we adapt a hybrid the intervention delivery, which we will be able to deliver intervention in person or virtually if patient is safe and also choose to do so. So the two intervention I mentioned to you earlier, that we will have capability to also deliver that virtually. And in terms of the physical function assessment, like we are also start to getting in the process, also developing the way we can perform or conduct the physical function assessment virtually. This require very careful thinking, and also some of the safety procedure, including like we need to make sure the environment, like, and also we need to make sure the patient have the adult companion, and we also need to make sure that the whoever the exercise professional or the patient and the caregiver will have easy access to any emergency contact, or like phone call, like, or number that we can act quickly, that when emergency um, happen. So here is an example, like Adam was conducting a virtual 30-second chair stand test, which he will be able to guide the participants and also the caregiver how to set up the testing course and make sure the participants doing the test in a proper form and all the setting is and those all the setting is appropriate and without any risk of fall or other injury. Um, the picture I'm showing here is like another device we sent to patients' home so we can monitor their heart rate variability. We also, start to or has been incorporated a lot of wearable devices to help us to monitor patients' activity level and also the sleep pattern. So here some example of activity tracker. So we have so many different model of the Fitbit and also the ActiveWell, which is a research grade activity tracker. We will be able to monitor their movements from different plane, right? So like front, back, middle, lateral, and up and down. So that will help us to monitor their, position, their sedentary behavior, and also the physical activity level. These are all other new wearable devices or portable devices that we are investing and will put into the study. And mainly is just like try to offer the opportunity to be able to do functional assessment virtually and also with some portable device. So I'm gonna pass to Adam and have him to share a survivorship program we offered and also have him share some of the experience that he worked with patients and survivors. And thank you. And Adam, take it away.
Thank you, PJ. I'm going to pull up the slides here. Okay, so Dr. Lin shared a lot of the research that we do at the Peak Human Performance Science Program and the NCORE research base. That isn't the only service that we offer. However, the Renew Exercise program is housed out of the Pluta Cancer Center. It's on 125 Red Creek Drive in Henrietta off of Culkins Road. You can think of the Renew Exercise program as a cancer-specific fitness center. The program itself is open and eligible by patients who have been treated at Wilmot within the last calendar year. We offer a number of services at this center. Patients come in, and the first visit is an exercise evaluation. We do fitness tests such as flexibility, range of motion, strength, agility, cardiorespiratory performance, simpler things like height and weight and blood pressure as well, to see where the survivor kind of falls on day one, if you will. We then have them come back for a one-on-one consultation where we go over the results to their exercise evaluation and we provide them with home-based exercise programming. Keyword there being home-based. We don't want exercise to be something that is a barrier. We want people to be able to exercise at home. We provide them with resistance bands. We don't want them to have to spend money to go and join a gym. With that being said, the services that we offer at the Integrative Oncology and Wellness Center, Renew being one, is free of cost for the patient. After their consultation, they are able to join us for small group in-person exercise classes. Those classes are once per week for 60 minutes, 30 minutes of cardio exercise, like walking on a treadmill or sitting on a bicycle or a elliptical, something like that. And then the next 30 minutes are done doing strength and stretch exercise. Those small group classes usually hold anywhere from 2 to 5 people. Where we do resistance-based exercise for whatever a specific concern or desire a patient may have, whether that's I really want to get stronger, I need to improve my balance, I'd like to lose some weight. We individually tailor our exercise programming, but also our classes based on individuals' needs, desires, and limitations. This slide here is pretty data forward, so I will just kind of summarize it for you. These data on this slide and the next are representative of 399 of our previous participants that have joined us in Renew. We have been open since 2018, and we are almost at participant number 800 right now. So we have been very busy. People rave about the program and really enjoy making exercise a habit. As Dr. Lynn mentioned earlier, we really want to make sure that our interventions or the things that we ask people to do are enjoyable and something that they are able to adhere to. Because if we give people exercise that they hate, they're never going to do it. And we want people to exercise because we believe exercise can be very beneficial for this population. So a vast majority of our patients that we see at Renew are women. There are some reasons for that, I think, but just the Pluta Cancer Center, if you don't already know, is a breast center, a breast cancer center. So there's a lot more women that come to us because they just walk right upstairs because we're in that building. Most often, with that being said, our breast cancer survivors are the highest of the population that we see, followed by hematological, gynecological, prostate, colorectal, et cetera, et cetera. Um, Oftentimes, people come in as part of the evaluation, they do a form called a symptom inventory where they fill out the severity of different symptoms that are common in cancer survivorship. And I highlighted here on table 3 two of the symptoms that are pretty prevalent: fatigue and anxiety. Fatigue, like Dr. Lynn mentioned, is one of the most prevalent symptoms and toxicities from cancer and its treatment, where 68.42% of our patients screened noted that they had some level of fatigue. Anxiety is also very common along your cancer journey. Um, so those uh, those symptoms are prevalent, but we have seen improvement in the severity of those symptoms through exercise that were new. Table 4 here shows cardio and resistance training before and after the Renew program. So basically, take-home message from Table 4 is before patients came to us at Renew, they were doing less cardio than when they leave our doors here after the 12 sessions. Same with resistance training. Very little days per week of resistance training before they come to us at Renew. And once they've left, they've done almost 3 days per week of resistance training on average, which is great because we always want to have our patients strive for the American College of Sports Medicine's recommendations for exercise for cancer survivors, which is 150 to 300 minutes of low to moderate intensity cardio exercise per week and at least 3 days per week of strength training. So you can see in those post-renew mean column that our patients are achieving the 150 minutes per week goal, and they're just barely below the goal for resistance training. Um, a lot of people are great with cardio, but a lot of people struggle with adhering to resistance training. But resistance training is very important, especially in an older population, which, of course, much of our cancer patients are. Table 5, lastly, a distribution of exercisers versus non-exercisers pre and post renew program. Just showing you how much patients exercised before or after renew. That's all the slides that I had. Here are acknowledgments for our presentation. I'm going to go ahead and pass the baton over to Autumn. Thank you.
See. Sweet. All look good, Christina?
Perfect.
Awesome. Well, thank you all for being here. Like Christina said, my name's Autumn. I am the Regional Health and Fitness Director for the YMCA of the Greater Tri-Valley. We're about an hour from Syracuse or 30 minutes from Utica. I've been with the Y for about 5 years now. I've overseen many different departments within the Y and have always been passionate about helping and bringing people together. So I'm here to talk to you about our Stay Strong program that we have to provide as a service at the Y. But before getting more into detail about the program, kind of just want to touch base and introduce our mission, which kind of drives us to create what we do and what we can. So the mission is to put Christian principles into practice through programs that build healthy spirit, mind, and body for all. So with that mission in mind, I believe we achieve just that with our Stay Strong program. It's not switching. Oh, there we go. I gotta click it. Okay. Sorry. So the Stay Strong program is designed to support individuals navigating their life while actively going through cancer treatment through holistic services. So the Stay Strong program is essential because the journey of being diagnosed with cancer obviously can be very physical and emotionally draining, along with many psychological challenges. The Stay Strong program is designed to provide and support those that are going through these challenges and help them stay healthy and positive, and bring a sense of community. The program also helps manage long-term and late side effects of cancer in its treatment, and it also offers personalized care, mental health support, and lifestyle guidance. Most importantly, it empowers the participants in the program to regain control over their health and well-being, and it also gives them a resource that isn't always available. By addressing the full spectrum of the treatments, the Stay Strong program not only improves the quality of life, but also promotes long-term health outcomes and reduces other health concerns that may arise during treatment. So the other two bullet points that are on there. So we originally started with a partnership through Oneida Health. They would refer their patients as soon as they were diagnosed with cancer, and then the participants would meet with the director, which is me, and kind of just get a over layout of the program and kind of just help them move into what we have. We did just recently receive funding through St. Agatha's, which is a breast cancer foundation, and I'll touch base a little bit more on that as I go. So some of the services offered but aren't limited to, they do come and go depending on availability for the providers that help us. So we do have a cancer exercise specialist, we have a support group, a massage therapy, nutrition counseling, luminary kits, YMCA membership, and faith-based Pilates, which is Pilates through prayer. Those are currently all the services that are offered right now. We have had music therapy and hopefully options for art therapy in the future. So I'll break down these and talk more about them. Many of the services, the providers donate their time, and they're all fantastic individuals to work with. Unfortunately, many of them have been affected by cancer, and that's kind of why they help out with the program, and they understand the impact that it has on somebody to be here. So our first one is the cancer exercise specialist. So this is a trained professional who designs safe and effective exercises programs for individuals diagnosed with cancer. This can help before, during, or after treatment. The goals is to improve physical function and mobility, reduce treatment side effects, support mental health and the quality of life. I'm actually in the middle of taking the course right now. It's very heavily loaded with information on all types of cancer. It touches base on what can and can't be done, but it's definitely patient specific. Every day is definitely a different day, and it'll have its ups and downs, but the cancer exercise specialist definitely helps provide support to staying active. The next is our support group. So this is a safe, welcoming space where individuals diagnosed with cancer can share experiences and receive emotional support. This helps connect others who understand what they're going through, reduce feelings of isolation and anxiety, gain tips for managing treatment side effects, and share some coping strategies for emotional and physical challenges. We also have massage therapy right now, which is a customized massage approach designed for participants undergoing or recovering from cancer treatment. They focus on comfort, safety, and promoting overall well-being. This helps reduce anxiety, stress, and depression, alleviates pain, muscle tension, and fatigue, and helps improve sleep quality and relaxation. I've had a lot of good feedback from this with the participants utilizing this service. The therapist has actually gone above and beyond and taken classes herself just to better prepare working with the clients and help them monitor what they need. We also have, which is probably one of the biggest benefits, is our YMCA membership. So that first bullet point with insurance coverage. So the first thing I do is I sit down with them and see if their insurance will actually cover their membership. We do have a vast majority of insurances that help cover the membership, so that's always a benefit. If not, we do have an option. Minimally, we cover a 3-month membership. This has helped out through the grants that we have gotten, so it's definitely nice. There's also pool and exercise classes, cardio and weights in the community. And when I say community, this includes anyone that's in the program, going through similar struggles, or anybody that's in the YMCA that just kind of brings support. Some of the other classes that are included with the YMCA membership, mindfulness meditation, yoga, aqua classes, bone builders, which is a class that helps with osteoporosis, and some balance and mobility classes. We do have a nutrition counselor. So this is actually with a separate organization to provide the services. This helps maintain strength, weight, and immune function, manage treatment side effects, reduce inflammation, and promote energy and a quality of life. This is actually a virtual setup, which is really nice. So then they can do it at the comfort of their own home, and they can do it on their own time. We do also have these luminary kits that were donated through the company themselves. This is a thoughtful kit filled with symbolic and practical items, to bring comfort, hope, and encouragement to individuals navigating their cancer treatment. So the cancer exercise specialist actually gives one kit for the first 3 months, and the participant has an option for a Fitbit, so it helps track their health and keep them on track. A few of the participants just use their own because they've already had them available, so it's nice. And then we do have a future for Stay Strong. Like many programs, we always want to see grow. So our hope is to provide help and/or help not only children with cancer, but their siblings and family going through that time. Also trying to find more funding options to cover expenses with other patients and families, provide more holistic services like art therapy and acupuncture. And we have recently started fundraising. We did just have a huge fundraiser, which I will talk about. So in May 2025, we had an incredible, successful benefit concert to help support our missions and ambitions. And not only did we have a successful fundraiser, on that same day, we actually were awarded the 55,000 for the St. Agatha's grant, which was great. So we're definitely honored to have the privilege to support people with cancer and families to the best of our abilities. The concert was great. We had 2 wonderful bands, and we actually had a couple of the participants in the program speak during it, which was great. Overall, it was a great night, and we definitely can't wait for the next one. So other than that, that's just kind of the gist of the overall Stay Strong program. There's quite a bit more, definitely more statistics that go into it, but I just wanted to leave it basic for everybody just to figure out what we kind of do here.
Thank you so much to the 3 presenters. I have learned quite a lot. In Autumn, I am incredibly impressed by just the vast array of things that are offered to cancer patients throughout the Y. That's amazing. So what we are going to do now is we are going to start with our Q&A. We have about 15 minutes. So if you have any additional questions that you want added, please make sure to type it into the Q&A box located at the bottom of your screen, and we will get to those. So let's start. We have from one of our attendees, it's great to see exercise being studied to help improve outcomes for cancer patients. Is there anything being done at Wilmot for cancer prevention / risk reduction? believe, in terms of exercise. So PJ or Adam, do you know of any research that's going on currently with exercise and risk reduction?
I do know we have many screening tests, more like early detection and also sort of like prevention. In terms of using exercise, uh, at least for our division and also for Peak Lab, most of the study we work with are more like cancer control studies, and but I would really strongly recommend people who are interested to participate in clinical trials. Like we have, the Wilma have the clinical trial office, and then they have a link. Actually, have this is all the opening clinical trials, which I believe including prevention and the control trials. And if you are interested and you are eligible, that guy, we will all appreciate your willing to contribute your time and effort to help our research.
That is a great suggestion. We can put the link to that in the follow-up email as we go through. But PJ, can you just very quickly explain what that means, what that might be if you sign up to be involved in these sorts of this sort of research through the clinical trials office? What might it be asking? I'm assuming it's not all just, medications or treatments. It is different kinds of interventions as well.
Yeah, it depends on each study, right? So like first of all, if you are particularly interested in any outcome or even just like a reduce the risk, and also consider what intervention they're using. And some of the prevention work, like even some of the studies actually observational study, they literally just like targeted to a specific population and follow them a long time, so not necessarily involve intervention. um, uh, I was just glancing through the our clinical trial office link, and most of those are intervention studies. So that involves some water intervene, and the intervention could be any supplement, could be some of the telehealth and medicine visits, can be intervention, behavior intervention, can be screening or like screening tools, and also like some of the like blood draw. So um, it really depends on each individual study, and so that will require every single study will have the eligibility criteria, and also if you agree and you need to go through the consenting process, and the process should very clearly describe what will involve and what you will be expecting if you agree to participate, and also if you are eligible to participate.
Thank you for that. And I believe too that some of them with the CTO can be anything as simple as a survey to fill out too as part of this. So it's not necessarily that you have to come in and get any work done. It can also be that you answer some questions from the comfort of your own home. Okay, so let's throw this question to Autumn. Autumn, how do cancer survivors find out about Stay Strong, and is it available at all of the YMCA's?
So no, it's not available at all YMCA's. Stay Strong was specific just to our organization. There was what was called Live Strong, but we were not accepted into that, so we decided to make our own. The way that we have our basis is more referral based. So Aneta Health does provide quite a few referrals. And then newly with the St. Agatha's funding that just came in, that's for anybody with breast cancer. It's very specific, which is unfortunate, but it is a very big population. And we do just accept referrals that way as well. Usually a lot of people do come, and I try to answer the questions as best as I can. But yeah, Stay Strong is just specific for our YMCA.
And as you said, I think for Livestrong, you have to apply to be able to host it, correct?
Yeah, and they didn't think we were big enough, so we did our own.
So I guess the best answer is if you're looking at a specific Y is to view the website or call that specific Y to get the answer.
I mean, not limited to them starting it themselves, they're more than welcome to.
Well, it does. It sounds like a fantastic program. I was very
It's good.
impressed. Okay, so let's see. For Adam, this is a great question for you. So for the programs that you are running, do you get a lot of participants from rural areas in these virtuals? And then PJ, if you want to answer too, for some of the studies that you're doing or how you're expanding, do you get a lot of rural participation?
So for the Renew program, we offer a class that is a small group exercise class that is virtual once per week, and that is a big that's people that are outside of Rochester have big interest in that class because they don't want to drive the hours to a small group in-person class once per week. We do need to see those people in, however, for an evaluation in person before they can join that virtual class. So for the rural or the outside of our catchment area people, that online Renew class is an option. But really, I think what PJ is probably going to answer is in the research side, the virtual is much virtual attendance is popular for people outside of our area for the research so that we can reach these people that wouldn't want to travel hours to come to Wilmot.
Yeah, so I do want to add. So, as I presented earlier, like we have this URCC Anchor research base. So when I mentioned that we have like a 31 affiliate sites, among those 31 affiliate sites, 6 of them are minority underserved areas. So those sites do see some of the people in residing in the rural area. So I will not say. I mean, we really try very hard to bring the clinical trial to participants, and so that's the platform. So we will always encourage like all the sites will participate to our study. In terms of like more locally, like I actually just recently complete a 100% virtual yoga study, which that study is particularly designed to to increase the opportunity or approach to people in the small town or rural area. So the way we design that we make everything virtually, so participant doesn't need to come into any of the visits, the screening, consenting, and even the intervention delivery and the assessment, the questionnaire can be done electronically. And for that particular study, we were able to recruit almost 20% of our study population are who are residing in the small town and the rural area. So a lot of the adaptation for our intervention to make it hybrid and virtual is part of one of the reason is we try to be able to bring the clinical trial to people who have limited access to or easy access to clinic or any of the supported care cancer program.
That's wonderful that you're expanding because I mean, we do get quite a few different patients and we always have interest from survivors that are out in the area, but it is very difficult to get into Rochester if you're not from the immediate area. So we had a question, and Adam, I saw that you answered it, but I want you to be able to say it so that everyone can hear in case they weren't looking at this. What if you just have surgery? Is it still helpful to do an exercise program? Is there any research that's being done on that? Does it help you to heal quicker if you do exercise? Any ideas?
Yeah, so if you just had surgery, the most important part is that you have clearance to participate in an exercise program. Oftentimes, people who just had surgery go to see physical therapy because of range of motion issues, strength issues, healing issues, whatever it may be. Oftentimes, if you have surgery, you have a lifting restriction, 5 pounds, 8 pounds, 10 pounds, whatever it may be. So we always make sure that we want to have clearance from your doctor to make sure that, yes, it is safe for you to participate in our exercise. We believe, and I think there is literature out there that says that if you go into surgery and with a higher fitness level, you will have better post-surgical outcomes. We love to see people in the Renew program before they go under the knife for surgery, because we have seen that if you are more strong, if you are more fit before your surgery, you may have better outcomes afterwards.
Well, and that's a great segue into another question is when should a patient begin an exercise regimen?
Yeah, so that's very person by person dependent. It's case by case. Us exercise professionals believe that if exercise was medicine, everybody would take it. But with that being said, there may be some circumstances where, hey, maybe we don't start you with exercise right now. Maybe it's a down the road type of thing. So without knowing a specific instance, it's hard to say when is a good time. I don't want to just put a uh, right now statement because it might not be the best time for everybody.
Yeah, I do want to mention, I think the safety is the most important thing, right? So as Adam mentioned, like we do need to have your provider in oncology or primary physician to give us okay to for you to participate to any to exercise. But I also want to say, exercise recommended to everybody, right? So like the most important recommendation, and most like essential and basic information is like to avoid inactive, to avoid being inactive. So whenever you are safe and you are ready, that's the time to start exercise. That will probably will be my suggestion. But I do think that safety is the most important thing, and that's also the thing we always make sure before we provide any of the prescription. And the other part is like I do also recommend like people want to start to exercise, seek for exercise professionals' help, right? So like the exercise professional, they have a very restrictive, a training, and also they will be able to provide individualized exercise prescription. I think the individualized is very important and key, and that will make you feel like you can enjoy and it's also helpful, and it's also prevent any of the possible injury.
Okay, I'm going to try to fit two questions in. So quick, short answers if we can. So for this one, with the exercise regimen, does it change? Do you do additional physical tests throughout treatment? I mean, in case treatment changes or the effects of treatment have changed on the participant?
Yes, so I totally forgot to mention this in my presentation. I apologize. We do a post evaluation as well. So after your 12 sessions of in-person small group class, we do the same evaluation as we did on day one with you so that you can see how much you have improved. And in a vast majority of the patients that we see at Renew, they do improve in more than one aspect of fitness, whether it's flexibility, strength, or their aerobic capacity. And we love doing that and showing people because, hey, all this time and effort you put in, here's your tangible results on the ways that you improved.
I also a quick note for the research perspective, like we also learned that like for the intervention study, particularly for exercise intervention study, we are not just like teach you once and then and provide prescription, then we don't do any of the follow-up. We do think it's right now it's very critical we have the follow-up booster session, and during that booster session we will understand your barrier or understand what has been changed medically or physically, then we will provide appropriate modification for your prescription. So we do think that is helpful, and that's also provide opportunity for us to closely monitor your condition and also make any adjustment if needed.
Thank you. And Autumn, okay, in the last, you get 10 seconds to answer this question. So with the benefits of this, you did say that it depends on insurance in order to pay for it. However, your YMCA has been working to get at least 3-month memberships for the patients. Does
Yeah,
that
so some of
include
the
access to
grants,
everything?
yeah, so some of the grants uh have that have been written are to cover memberships. Right now it's I say minimum because we haven't had as many participants use it yet, so I'm able to extend the membership out because I still have the funds to do so. I just like to do the insurance because then I don't have to worry about using the expenses for a membership, but I can utilize it for other things.
So what I'm hearing is don't let insurance be the the barrier to you
Yeah.
being able to join any type of program. So this is wonderful. It sounds like for patients through Wilmot, we have a wonderful option of going through integrative oncology, and we have amazing research that's being done here. And for those that are out within our region, the YMCA is a great resource to be able to access. So I want to really thank our 3 presenters today for joining us. I learned a lot. I hope that everybody that was on here learned a lot as well. Please be sure to fill out the survey following the webinar to make sure we're providing content that you are interested in hearing about. Surveys must be completed to receive any continuing education credit. So you will receive a link in a follow-up email. The webinar has been recorded, so if you will be receiving an email with a link to the video as well. So thanks again to everyone for joining us, and we'll see you at our next community conversation in August, focusing on lung cancer stigma. So until next time, bye-bye.